Hey, this is Nicholas. Let's talk about how to ask the 10 questions and how to get the information you need, even when your patient isn't very talkative. The way it usually goes is, your patient comes in, you get a chief complaint, you get a history of the chief complaint, and then you go into the review of systems, or what we also call the 10 questions. But this part actually requires some skill. You want to ask these questions in a relaxed, conversational way that makes the patient feel comfortable and establishes some good rapport. But you also want to make sure you're managing your time efficiently and that the patient doesn't go off on too many tangents. And then you get those patients that are just not very communicative. Everything is good, or fine, or normal, or no complaints. And not only is that not very helpful in terms of establishing a diagnosis, it's also the kind of thing that they like to yell at you about if you try to write that down in your charts. So when it comes to asking the 10 questions, this is how I like to do it. First, start by asking the question in a very vague and open-ended way, like, how's your sleep? This leaves it very open for the patient to report anything significant that's going on, and it also prevents you from leading the witness. Sometimes people go into a treatment with a diagnosis already in their mind, and then they start asking questions in a way that guides the patient towards their preconceived diagnosis. And that might prevent you from getting the whole picture. But then if you ask that open-ended question and you don't get the information you need, they just say, good, fine, normal, then you can move on to more specific follow-up questions. Things like, do you fall asleep easily and stay asleep? If you do wake up, is it easy for you to get back to sleep? Do you sleep soundly or do you toss and turn a lot throughout the night? Do you have a lot of vivid dreams that end up disturbing your sleep? In the morning, do you wake up feeling refreshed? So this gives you some more specific information that you can use towards your diagnosis, and it also gives you something that you can write down in your charts. So even if there's nothing really wrong, instead of writing good, fine, or within normal limits, you can write down something more specific, like falls asleep easily, stays asleep, wakes feeling refreshed. So this is a good habit to get into, asking these specific follow-up questions. Because a lot of patients will initially say that their digestion is fine or that their period is normal, but once you start asking more specific questions, it turns out things are not fine or normal at all. There's actually a lot of stuff going on, it just didn't occur to the patient to report it. This can also be really helpful because sometimes the patient just doesn't understand the question in the way you're trying to ask it. For example, a lot of times when I ask about digestion, the patient thinks I'm asking, do you have diarrhea? So I like to follow up with more specific questions like, do you have any gas or bloating, or any nausea, abdominal pain, or acid reflux? And again, even if the patient says no to all those things, that gives you something you can write down. So in your chart, you can write, patient denies gas, bloating, and acid reflux. So just to give you some more examples, here are some other specific questions that I like to ask. How's your energy? Is it pretty consistent throughout the day, or do you feel like you need a nap in the afternoon? When you wake up in the morning, do you jump out of bed and sing a song about what a bright new day it is, and then the birds come in and help you make breakfast? Or do you hit the snooze button like 5 times and say, don't talk to me until I've had my coffee? And how are you body temperature-wise? Do you tend to run hot or run cold? Like, do you wear sweaters all the time because you're always freezing? Or do you ever say, is it hot in here or is it just me? And everyone's like, it's just you. And when you say you're cold, does that mean your entire body is cold or just your hands and feet that are cold? Any unusual sweating? Do you sweat at night or do you sweat during the day even though you're not exerting yourself? How's your appetite? Are you ravenously hungry all the time? Or do you just eat because the clock tells you it's time to eat? Do you crave certain foods? Any unusual thirst? Like, are you constantly thirsty? Do you prefer warm beverages or cold beverages? So how's your elimination? Any constipation or diarrhea? Would you say that you go about 1 to 2 times per day and the stools are well formed? And when you say you have constipation, does that mean that the stools are dry and hard? Or does that just mean that it's difficult to get out? Again, a patient might say that they're constipated, but then when you ask more questions, it turns out they're going every day and their stools are well formed. It's just difficult to get out and feels incomplete. So in some of these situations, if a patient says something, you have to ask, what does that mean to you? And how's urination? Any pain or a burning sensation? Any incontinence? Do you wake up at night to pee a lot? How many times do you go during the day? Any difficulty starting the stream or a feeling that it's incomplete? And how are the periods? Do they come regularly? Are they usually heavy or light? About how many days do they usually last? Any clots? And are those clots more like dime-sized or are they more like quarter-sized? Any pain, cramping, or breast tenderness? Or any fluctuations in the emotions? Any headaches? Any eye problems like dry eyes, red eyes, itchy eyes, floaters in the vision, or poor night vision? Any problems with the ears, like a block sensation in the ears, ringing in the ears, or decreased hearing? Any nose or throat problems, like congestion or sinus problems? Any TMJ, clenching of the jaw, or grinding the teeth at night? So those are just some examples, and again, some of these questions will require even more follow-up questions. For example, if a patient says that they have ringing in the ears, you'll want to ask more follow-up questions like, is it one ear or both ears? Is it constant or does it come and go? Is it loud or is it soft? Is it high-pitched or is it low-pitched? Things like that. So we're not really going to go into the diagnostic significance of these questions. This is more about giving you examples of how to ask questions in the clinic and how to get the information you need from your patients. So again, start out with a vague, open-ended question and see what you get, and then move on to more specific follow-up questions. So let's turn it over to you. What strategies do you use during a patient intake? How do you deal with patients that either talk too little or talk way too much? Let us know in the comments below. So I hope you enjoyed this video, because that's all for today. Thanks, and see you next time.